So good evening again, bonsoir. Thank you for taking the time to join this webinar hosted by the New Brunswick College of Pharmacists. My name is Karen DeGrasse. I'm the Communications Manager with the college, and I'll be acting as moderator as well for this event. The event is taking place in English and follows a French presentation that was held at 6 p.m. Both webinars are being recorded and will be made available for reference at a later viewing. La présentation est bilingue, alors si vous avez des questions en français, vous pouvez les demander si vous voulez dans la langue française. In a moment, I will welcome our speakers. But first, the New Brunswick College of Pharmacists respectfully acknowledges that the land on which we live and work is the traditional unceded territory of the Maliseet, Mi'kmaq, and Passamaquoddy peoples. The treaties of peace and friendship which Maliseet, Mi'kmaq, and Passamaquoddy peoples first signed with the British Crown in 1725 did not deal with surrender of lands and resources. The treaties, in fact, recognized Maliseet, Mi'kmaq, and Passamaquoddy title and established the rules for what was meant to be an ongoing relationship between nations. We recognize these treaties and are grateful to the first peoples of these nations with whom we share this land. Now I'd like to go over a few housekeeping items. So again, please make sure your computer, or laptop, or mobile device is on mute at all times. There will be time for questions following the presentation, please. So please hold your questions until our guest is through delivering that. And when you do, you can use the raise hand function, or you may enter a question in the chat. So let's get started. I'm very pleased to welcome and introduce you to Deputy Registrar and Director of Quality with the New Brunswick College of Pharmacists, Heather Christ. Heather.
Thank you, Karen. As Karen said, I'm Heather Christ, Deputy Registrar and Director of Quality. And on behalf of the New Brunswick College of Pharmacists, I'm pleased to welcome everyone to this evening's webinar. The information that will be shared is intended to provide a preview of upcoming changes related to MyHealthNB and to reassure pharmacy professionals that inquiries from patients relating to their personal health information within MyHealthNB can be directed to the Government of New Brunswick. The college is committed to enhancing engagement and collaboration with pharmacy professionals, the public, and health system partners, and hosting this webinar aligns with that strategic plan objective. I'm very pleased to welcome Anik Hall. She is a MyHealthNB Senior Change Manager with the Department of Health, who will be our presenter this evening. Anik, the college appreciates the time you're taking to share this important information with New Brunswick pharmacy professionals. So welcome. And with that, I will pass it over to Anik to get started.
Thank you so much, Karen. Thank you so much, Heather. I'm gonna share my screen and let me know if you can hear me well. I'm gonna direct to Karen. Clarice, okay, that's good. I'm gonna share my screen. We're good to go, Karen?
Yes, everything's good.
Perfect. Thank you so much. As Heather mentioned, my name is Anik Hall. I'm the Senior Change Manager with MyHealthNB. Very happy to meet with you today. And we're very happy that you're taking some personal time to meet with us today. So the goal of the session is to inform you on upcoming changes in MyHealthNB. And after that, we will be able to answer any question that you have. And we're going to highlight the tools that we're going to be distributing to you. Should you have any question as it relates to MyHealthNB, or if citizens are asking you questions. So that's the goal of the session tonight. The agenda, we're going to review key messages, and after that we're going to go over the roadmap, what we have introduced, what's upcoming, and after that, lastly, we're going to go over more information, and you will have time to ask any question that you have. So MyHealthNB key messages. Think about MyHealthNB as the citizen portal. You as a clinician, you have EHR. So now citizen will have access to some of the same information in their portal, MyHealthNB. MyHealthNB is a web portal for citizen. We're not asking you to learn how to use MyHealthNB. This is for citizen. you as a citizen can access MyHealthNB, but as a pharmacist, we're not asking you to log into MyHealthNB. This is for citizen. MyHealthNB, you will see if you use it as a citizen, you will see that COVID-19 will remain there as a tile. And what we have introduced in January is My Health Records, Mon Dossier Santé. So when the citizen click on My Health Records, he will be seeing the 4 domains that we are going to talk about tonight. So the lab is one domain. We have introduced the vaccination, immunization. This is another domain. In July, end of July, we will be introducing the dispense medication list. This is the 3rd domain. And end of August, we will be releasing imaging results, DI reports. This is going to be the 4th domain. So MyHealthNB, the portal. When a citizen is enrolled, he can click on COVID-19. That will be separated from other domains because of all the communication and the change management that happened with COVID-19. So this will be separate. We will be, he will be viewing another tile, My Health Records, Mon Dossier Santé. So I just wanted to introduce you to a new definition or introduction in the portal, MyHealthNB. COVID-19, My Health Records, Mon Dossier Santé. Another very good key message that we want to share with you tonight. So MyHealthNB is for citizens of New Brunswick, 16 and older. So this is the guideline that we are working with. NB citizen with a valid Medicare, and the citizen needs to be 16 years and older to be able to create an account in MyHealthNB. Out of scope right now is the consent management. You might be thinking, oh, that could be a good value added if I can see my spouse, or if you're taking care of your elderly parents. So right now it's out of scope because you would appreciate that because of the security and the nature of the data. We need to make sure that we have a sound audit trail in MyHealthNB to be able to track when a citizen is granting access, and the same when he's revoking access. So we need to be able to have this in an audit trail format. So it's out of scope right now, but this is something that the team will be working on because this is value added for citizen, but out of scope right now. So you will not be able to see your children results or your elderly parent or spouse. So out of scope. Right now, 48,000 citizens have viewed their lab results since we have released them in January. So provincially, 48,000. Just to give you an appreciation of the number of users right now. One other good information that we wanted to share with you tonight, MyHealthNB, we query and view from the GIS for dispense medication, and from EHR for the lab and imaging results, and from the Public Health Information System, FIS, for the vaccination. So you have an appreciation that we don't store any data in MyHealthNB. It's the query and view only. The next slide will be in regards to the roadmap. And lastly, I will go over more important information, and we will have time to entertain any question that you might have. The roadmap, I've mentioned that we have released My Health Records in January. So I've mentioned also the introduction of domains. So lab is a domain, and inside the domain, we are going to release lab categories. So when a citizen is clicking on the lab domain, right now he can see his general lab, the core lab, serology, chemistry, coagulation challenge. This has been released in January, and you see here the mention of 7-day delay. Because we are querying from EHR, so when the result is available in EHR, in theory, it could be also available in MyHealthNB. With our advisory council, we have clinicians that are advising us and best practices with other jurisdiction, because other provinces have done the same. Quebec, they have the health booklet, Le Carnet Santé. Alberta, BC, Ontario, Newfoundland, they are providing patient with a patient portal with to be able to see their similar information, lab, GI, medication list as well. And it was recommended that we go with a delay at the beginning, just to make sure that clinicians have time to view the result prior to the patient, because some when we have consulted, some clinicians are not using EHR as we want them to to use. So we just need to be aware of that, with the desire to remove the delay for less sensitive, like general lab and microbiology, when it's the right time. Okay, just you're aware of why we have a delay, and the desire to remove the delay with proper consultation. We have released immunization June 7th. I've mentioned that we are querying from the Public Health Information System, FIS. You have been, I think, via the college and the association, given the one-pager and some FAQs, so that you are aware of what's included and what's excluded in terms of vaccination. So what we are releasing, it needs to be in FIS. We cannot display something that's not in FIS. The same with lab and dispense medication in DI. Needs to be in the provincial source data that MyHealthNB is querying from. So just you are aware of the source where we are querying from. End of July, we're going to be releasing a microbiology report, as well as dispense medication. So that's why we're taking time tonight to engage with you. Should you have any question, that we are there to answer your question and hear feedback, comments. So I've always, every time we engage, we want to make sure that you have time to ask question, and we're going to take your feedback and improve on our FAQs or any processes that we can improve based on your feedback and comment. August, we're thinking end of August right now. We're going to release GI reports, not the image, but the report, and the remainder of the lab categories: pathology, transfusion medicine, molecular genetics will be part of the category that we will be releasing in the lab domain. You see here that it's very important for us to continue our engagement in citizen and clinical engagement. This is a good thing for citizen, but we need to hear clinician feedback as well. Very, very important that we keep the engagement ongoing. You might be thinking, what citizen will be able to see when we're live with dispense medication? They will be able to see a list of their inactive and active medication. Inactive medication means that the refill is, there's no additional quantity in the refill, so it's inactive. And active means that they still have quantity to be refilled. And you will see that the order here, it's based on the last filled. When a citizen will be clicking on a medication, a detailed screen will be appearing to him on My Health Records, and they can print the information. Details like the pharmacy, was it a Jean Couture, Shoppers, and SIG information in the direction. Okay, so in a nutshell, this is what a citizen will be able to see. He can choose to change the information in French or in English. And every time we are releasing a domain, we are releasing guides as well to support citizen with what we are releasing. So we use the guide because we cannot meet with citizen on a one-on-one MyHealthNB. So we're using the guide as a tool to communicate key information to citizen. So in the guide, we will have FAQs, what's included, what's excluded, how to print, and if they need support, they will have access to, we have MyHealthNB, we have a support desk, so they can help citizens if they need to register, if they have any technical issues. So we have a help desk, and they will be able to view that information in their guide on the portal. I've mentioned that we have more important information to share. So I've mentioned on the previous screen that citizens will be able to see the SIG. So based on the assessment that we have done, because every time we are working on releasing information, we assess, is there any sensitivity in the data? So we're doing that with lab, we're doing that with DI. We have done the same with the pharmacy as well. And we know that since the SIG is a free text, some information can be there that might be sensitive for some citizen. So we just want to take the opportunity tonight to that you are aware that the SIG will be displayed in My Health records when a citizen is viewing his medication list, so that you are aware that citizen will be able to see what's entered in the SIG. One other important information, depending of how the citizen registered with COVID-19 for MyHealthNB, at the time, because of the sense of urgency, we were allowing citizens to register with their IR code, the date of vaccination. So now with the nature of the data, lab results, NDI, we are not allowing the IR code. We are more strict. So what we need to, what the citizen needs to do, he needs to log into MyHealthNB. He will see COVID-19. He will see the new tile, My Health Records. If he requires a registration code, he will see a log. If that's the case, he will be able to see some verbiage on that, where to get a registration code. Right now, it's with RHAs, Horizon and Vitality. At your next blood appointment, when they are registering, if they ask the clerk, she will be able to give them a code. It's going to be printed from their Meditech system, so they need to keep the sheet, and they can increase their access level with that code on the portal, and it's only a one-time type of situation. They will be good to go to be able to view their lab, dispense medication in DI. Some citizen thinks that they need a code for every domain. It's not the case. If they are seeing the log, they need a registration code to unlock, and after that, they will be good to go. We're very happy to inform you that starting July 10th, a citizen can go to SNB service centers, the same service centers that you go to have your driver's license renewed. They will be able to ask for a MyHealthNB registration code. So that's very value added, because for some citizens, it's not very convenient to wait for their next appointment. So we're very happy that we were able to use SNB service centers for that. Very important in prepping for the release of dispense medication in My Health record, that you use the one-pager. Ideally, if you can print it, that would be ideal for your own usage internally at your pharmacy. That if a citizen is asking you any question or talking to you about, I want to register, but I have a hard time, you can quickly guide them to the portal or the support line. We don't want you to help the citizen registering, and that's not, we're not asking you to do that. So that will be very useful instead of looking in your emails, that you can print a one-pager, put it where is best visible to your situation at your pharmacy, that you can guide a patient if they're asking you a question, or if they need support, you can quickly guide them to the portal or the MyHealthNB support line. That was the last slide, and I just wanted to inform you that we have a monthly touch point with Heather in the college. So should you have any question, concern, please feel free to send your question or email to Heather, and she will be able to liaise with us. And if you don't have any question tonight, but you will have some after we're live with dispense medication, please feel free to send your question or comments to Heather. So that was my last slide. So thank you so much for your time. If you have any question, I will be able to enter them right now. Thank you.
Thank you, Anik. And thank you everyone for your participation. We're close to the conclusion. As Anik said, we'd like to give you the opportunity to ask questions because you have not had that opportunity yet. We do have one written question. Will the DI be a 7-day delay as well?
That's a very good question. No, so it's only, thank you for asking. It's only for lab in, was it DI or DIS, Karen?
I just see DI.
DI, okay, that's a very good question. So what we will be releasing the rest of the lab categories in DI will be with a 7-day delay. So what we don't know now, it's for more sensitive report like pathology. There's discussion of increasing that delay, but we haven't settled on that yet. So what we know now, it's a 7-day across for the remainder of the lab categories, pathology, cytopathology, transfusion medicine, and all of the DI categories, CT, ultrasound, MRI, CAT scan. Very good question. So to continue on that note, immunization and the list of medication, no delay, right? So only lab and DI. A very good question. Thank you for asking.
Go ahead, Anne-Marie.
Here. And I don't want to take away from other people who have questions. Can you hear me?
Yes.
Okay. There's just a couple things that I just thought, after speaking with Anik and going over all of this, and thank you, Anik, and your team for providing this opportunity. A couple of things with regards to the SIGs. For some of you, your SIGs may be very, very easily translated from English to French. And so what's on your hard copy is the same thing that's showing on your labels. Sometimes there's a little bit of discrepancy and you have to say, oh, the label is correct, but, it's not quite showing on the hard copy side. And that's system limitations with some of the software, which will be, hopefully worked on sooner. But, understanding that what the patient is going to see is really what's on the hard copy side. And when I say hard copy side, I mean whether you're signing a hard copy or whether you're seeing it, electronically, it's not what they're seeing on their label. So there may be a bit of discrepancy. So patients may have some questions about that, just so you know that that's what you're seeing. So when she's talking about the SIGs, as well as any sensitive notes that may be put onto that hard copy portion, outside of the, if it's outside of the prescription itself, it's fine. If it's in the patient profile in their notes section, it's different than if it was on the actual prescription portion of it. Those notes will show. So just being aware of the sensitivity of that, I think that that's really important. A couple of other things that we think that you might end up having and questions about is, will patients be able to see prices? Will patients be able to print their tax returns? Not tax returns, but tax, receipts. And none of that is on there. So I just as a couple of pieces that we've talked about as we've discussed this, just to give you some ideas of some of the things in those, frequently asked questions and things like that. It's certainly encouraged to look at those to be able to, know what people are going to be coming back with. I just wanted to kind of throw that in for you guys.
Thank you, Anne-Marie.
That is really good, Anne-Marie, from the practical sort of operational side of things. So thanks for that. I've long had some concerns about the software that that sort of jumbles sort of the French and English when you're using SIG codes and that type of thing and doing part of it longhand. So it is a concern, and I had not thought of that one until now. But yes, you're going to probably see some SIG lines that will be partly in French, partly in English, depending on if you're using a code or if you were just typing it out. So that's good. Thank you for that. We'll keep an eye out for it. And I do hope that gets fixed. It's been going on now for 11 years since I started.
Yeah.
And it would be nice if that could get cleaned up.
Yeah, well, I think now it's going to be a prime opportunity for them to see that it's essential, so that, you know, we're not going to create any confusion. Anyway, I don't want to.
Yeah. No, that's good. Thank you. Appreciate it.
Nick, I'm not seeing any other comments in the chat, and I don't see any raised hands at the moment. And Nick, you mentioned earlier that this is not the only opportunity to ask questions. You're encouraged to reach out to MyHealth, of course, as this rolls out and as people start finding out about it and going into the pharmacy and asking questions. And as you go through it, you're able to still reach out and ask those questions. So this is just an opportunity to share it in advance, but you're able to continue to reach out.
Thank you so much, Karen. I see a good opportunity to meet again in September or October if Heather wants to invite me again, because you will be the voice. You will be hearing what type of questions citizens might be asking. So it's going to be a good opportunity for MyHealthNB as a program to improve on our FAQs, right? Because we want this to be value added, I think we will need to have your input of, because right now we're prepping you, we're releasing FAQs, but we're only anticipating the type of questions. So we really see value in hosting another session, or if it's not a session, gathering your feedback post live. I see a good opportunity in continuously improvements on FAQs, right? And the type of question that citizens are asking you. We're doing the same with clinicians, with family doctors as well, right? So we've done the prepping, and now we're like more into the real type of question to make sure that we can update our FAQs. So thank you for that, Karen. That's very good.
So there is a question in the chat. It is, if I give a twin Rix, will it be on the immunization list or drug fills?
I think the twin Rix, we need to first assess if it's part of the FIS or not.
So if it's administered by the pharmacy, we don't capture that yet, Nick.
Okay.
And it's not transferred over to FIS, so that would display as a dispense under the medication list.
I've been taught to think that way. If it's included in FIS first.
Yeah.
Thank you, Shannon.
No
Shannon is part of the Department of Health. She's working as a subject matter expert for MyHealthNB. So she's a very good resource for MyHealthNB. So thank you for your answer, Shannon. Was it clear, Karen? Was it?
I'm not sure. Whoever, I just see guests. I'm sorry, I don't know who posed the question, but if you want to speak to the response and let us know if that was sufficient. And I'll give you a couple seconds there, and then I have a couple more comments in the chat that I'll relay to you, Anik.
Okay.
Okay, I'm not seeing any hands raised, or I don't hear anybody that's unmuted to qualify that. So I'll just continue on. The next comment was, just want to clarify, community will be able to see hard copy that pharmacist signs and records notes on drug interactions. Plus, will they see the original prescription with pharmacist notes? You can unmute. Did you understand that, Anik, or do you want Linda to maybe ask that question?
I will use the same principle if it's currently available via DIS. the drug information system. So I will use the same principle because, as I mentioned, it's very important that you understand where MyHealthNB is querying from. So our source is the drug information system. So right now, I don't think, Shannon, that we are displaying any information regarding the notes and.
No. When we were talking about notes, we were strictly mentioning notes that are sometimes entered in that SIG field.
As a free text.
Yeah. Exactly. Yeah. Maybe not meant for a citizen to see. So those, of course, would come over to us where it is in the SIG in a dispense, but anything in the patient record, in the patient profile at the pharmacy, as far as notes, allergies, medical conditions, things like that will not display in MyHealth, as that doesn't come to DIS yet.
That's okay. What's in scope now? So
Yeah.
Karen, can you confirm if the answer was good for who requested the
Sure.
question? We just want to make sure that.
Yeah, I see Linda Mahoney. Was that, you just want to give a raise hand, or you can unmute and just confirm that that was okay? Or if you have an additional follow-up question to that, feel free.
Oh, thank you. And I will, if you don't have access as a citizen, I will highly recommend that you because it will be useful. You will be able to see what citizen will be seeing in MyHealthNB as it relates to medication list, right? So if you are requesting a reg code, you will be able to go to SNB. So every time we engage with clinician, we try to, ask them to use it as a citizen as well. So they will be able to see the same thing.
I found it very useful tonight,
Yes.
Nick, to hear you say that MyHealthNB really is just a requesting platform.
Yeah.
And so from the DIS, it's the very same information from the DIS that a patient is going to see. The format is a little bit different than what we as pharmacists see. Like just the way it looks on the screen, but that's the same information that people will see.
Yeah. Exactly. So that's why I wanted to make sure that the pharmacists had an opportunity to hear the key messages.
Yeah.
That we query the same information. That's very key for the lab report and the DI as well, because if they show it to their doctor, it needs to be the same. But you said maybe the front end will not be, but the report will be the same.
Yeah.
Thank you, Heather.
Good. I had an additional comment to the earlier question when we asked the question about the Twinrix, was another way to think about it is whether or not it's a publicly funded vaccine.
Exactly. Oh, you're so good. Yes. Yes.
That's not me. That was yeah. So
I was very impressed, Karen. Yes.
I have another question. That was, will a tetanus shot be given at the hospital show up in MyHealth? So I think you have a quick answer to that.
You're quizzing me. So I've been told that what's going to be inside the hospital is not currently transferred in FIS. And Shannon, you can correct me if I'm wrong. That's my understanding.
No, you're right, Anik. Yeah.
Because we have engaged with clinicians inside the hospital, and I've been asked the same question. So right now it's not transferred in the FIS system.
So there was another question. Thank you for that question about the tetanus shot, by the way. I don't know the name, so the next comment was, when did you say you could go into Service New Brunswick to get the code? I believe you said July 10th was the date that's going to be available at Service New Brunswick.
We're always careful with date. This is the date as we know today. Might change, but this is the date that we know today. So we're very happy about that, though, because I know that a lot of citizens, it was not very useful or value added to wait. So they are very happy about that. The date that we're working from is July 10th. That citizen will be able to go to SNB service centers to ask for a reg code. So if that's changing, I will be informing you, Heather, so you can inform the group if the date is changing, okay?
That's great. Thank you.
Yeah, I'm always hesitant with date, so.
And we
With
have
every
learned,
project.
we have learned to, yes, yeah.
Yeah.
I think we all are, yeah.
Yes. So the next question was, what was the rationale behind getting an additional code when someone was already registered to see their COVID vaccines?
That's a good question. So depending how they're registered, right? If it was not with a Medicare and face-to-face, it's not strong enough right now in displaying more sensitive data. So that's the rationale. Okay. So that's why we have like a segment of the population that needs a code. So it's because of the nature of the data that we are displaying. That was okay with COVID, and we are more strict right now because of the report, the lab, and the DI.
That seems to be a satisfactory answer. Thank you, Anik.
Okay, thank you.
And so just to clarify, I guess, onto that, when you say it can be requested at a Service New Brunswick center, that is in person, not online.
In person, not online. We're looking at a virtual option, but that's further down the road because that will be more convenient for a citizen. But we need to finalize that processes with the camera and yeah. So it's another process that we are currently working on, but we don't have any dates as of now.
Okay, so that's validating identification.
A virtual, yeah.
Thank you. I don't see any further comments in the chat right now. We'll give it a couple minutes, maybe a minute or so, and see. So while we're waiting, I will remind everyone that this was recorded, so this will be published for you to be able to access it in the future. Again, as people start to come into the pharmacy and as you start to see the additional rollouts from MyHealthNB, this and the French one prior was recorded, and the college will publish this and share it in an email. So there aren't any further comments, Anik.
Very good. Thank you so much for inviting me, Heather and Karen, and thank you so much for taking the time to meet with us tonight.
Yes, thank you.
Thanks for coming, everybody.